everyone agrees we need health care reform. It should follow the principles of expanding competition, empowering patients, and keeping government from getting in between us and our doctors. We should allow people to purchase health insurance across state lines. We need to change health insurance so that it's no longer tied to employment.
We'll pass common sense health care reform that makes health insurance personal and portable and affordable.
If I am elected president, we will repeal every word of Obamacare.
I pledge to direct the Department of Justice to open an investigation into Planned Parenthood.
Wow. So all week we've been examining the health care plans of the presidential candidates that remain. Today, we are checking in on Ted Cruz. Fox News Medical 18 member Dr. Marc Siegel is here to break it down. So we know Ted Cruz wants to get rid of Obamacare, says it every single time. What will he do?
And as you pointed out before we came on, his big thrust is, day one, I will repeal every word of Obamacare. But what is he going to replace it with? Well, the first tenet in his plan would be portability. Now, we've been talking portability all week, Brian, meaning that you can if you buy insurance in Nevada, you can bring it to New York, across state lines, anywhere in the country. But he's going to create a nationwide marketplace. Get rid of the state marketplaces. Get rid of the state exchanges and make one big national exchange where everyone in the country goes to buy insurance. Also, portability. If you leave your employer, you take your insurance with you. Okay. So you can keep the plan you have and your doctors and your network no matter where you go from one job to the next. So that's an advantage, and that will get rid of some of the waste in the bureaucracy.
And he also has health savings accounts, correct?
Huge on health savings accounts, and I personally love health savings accounts because people come into the doctor's office, they know what they're buying, they're very frugal, they know the cost of things if it's going to come out of their pocket, even if they get tax credits. And by the way, he also wants tax credits for buying insurance through the Christian Coalition.
All right.
So he's involved with the Christian Coalition in terms of getting subsidies for buying insurance.
And he's also vehemently come out against Planned Parenthood.
Hugely against Planned Parenthood. He wants it to be investigated by his Attorney General on day one. He says it's the #1 abortion provider in the United States. He doesn't care what services it provides for women. He wants it defunded, number one.
And as we see his full screen, repeal the Affordable Care Act. He also wants, as you mentioned, the health savings accounts in there. He also wants to increase the age for Medicare.
Well, #1 on Medicare, Brian, he wants to privatize Medicare. In other words, get those HMOs involved, what we call Medicare Advantage. Get the HMOs paying for Medicare. You get more services that way, and it's more streamlined. It's called Medicare Advantage. On top of that, he wants to raise the retirement age. And I'm for that, because when Medicare started in the 1960s, 65, you were at death's door. Now, if you're 65, you're on a treadmill, you're running around. So 65 is not what it used to be. I think, 70, 68, 70 might be more realistic, save a lot of money.
You might hate the Obamacare, you might love Obamacare. It is a plan. Is this a plan?
This is cobbling together. I say this is different aspects of a plan, a bit here, a bit there. It needs more thinking, it needs more process, but it's heading in the right direction in terms of competition and choice.
Right, in much more detail than Donald Trump.
Absolutely.
All right, Dr. Marc Siegel, thanks so much.
Great to see you.